Good afternoon and welcome to this PACTV update from Plymouth's response to the coronavirus. I'm Steve Trifletti, Plymouth Town Moderator, and joining me once again we have a group of guests each day. Kenneth Tavares, Chair of the Board of Selectmen, is joining us along with Representative Matthew Muratori. In addition, we have a number of additional guests today. We welcome Joseph McDonald. He is the Sheriff of Plymouth County. We also welcome Matthew McDonough, who is the Register of the Plymouth Probate Court. We're also joined once again by Brigitta Keene, and she is the Chairwoman for the Plymouth Board of Health. Also Amy Naples, who is the Executive Director for the Plymouth Area Chamber of Commerce. And for those of you that have questions for our panel today, you can email to plymouthinfo@pactv.org. You can watch us on Comcast on Channel 15, on Verizon Fios on Channel 47, and also live streaming on pactv.org. We're going to be doing this every day at noon. We have people coming on every day. We're going to begin with our Selectman Chair, Ken Tavares. Welcome, Ken.
Morning, or now good afternoon. I want to start out by once again thanking so many people in the community that are coming forward and taking up tasks that are going to help us get through this crisis. We're going to have later in the week, there's a group in Plymouth that is coming together that they're going to be actually making masks for the local hospital. And they're setting up a workshop so that they can begin this process. And hopefully on Tuesday, one of the women in charge of this group will be coming on the program. As I said yesterday, we need help, and we need help by just following the guidelines, washing hands, being careful how we gather together. And this is extremely important. We can flatten this curve if all of us get together and do this. And also, I want to thank, again, many of the people that are doing good deeds in the community, getting great feedback from the restaurants and people that are going to them. It's providing a need, and that need is being met. So I'm ready to pass this on, Steve.
Thanks, Ken. And what Ken said certainly about the restaurants, I can, from personal experience, tell you, last night my wife and I ordered a local restaurant. I pulled up, I parked in the parking lot, an attendant came out, didn't have contact except to sign to pay the bill. They brought it out, didn't have to go in. There was no contact at all. So it's been very safe and healthy. And we want to thank all the restaurants in the community, and I'm sure Amy will be talking about that shortly. Today we'd like to go to some of our newer panel guests. We want people who are watching to know that local Plymouth officials are working with state and county officials in order to make sure that government continues as it always has. And today we welcome two officials from Plymouth County. We're going to begin with our Plymouth County Sheriff, Joseph McDonald. Welcome, Joe.
Thank you, Steve. Thank you for having me.
Joe, what can you tell us about what happens in your world at the Plymouth County House of Correction, which is right here in Plymouth off of Long Pond Road?
That's correct. A lot of things going on down at the Sheriff's Department. Mostly us trying to adjust to a lot of the social distancing, things like that. I am happy to report, there have been a lot of questions that we have received about the health and safety of our inmates, our staff. I'm very happy to report that there are no, knock on wood, there are no cases of the COVID-19 virus within the correctional facility. Having said that, we are taking exceptional steps to sanitize surfaces, sanitize ourselves. We are limiting staff in there. We have cutoff visits, and I understand this can pose a hardship many times for families, and we've gotten a little bit of pushback on that, but I think people are beginning to understand that the reason we're doing this is for their health and safety as well as our staff and inmates as well. As you can imagine, there's been a lot of question, people talking about or thinking about overcrowded jails. I want to dispel that myth right now. Our populations have been declining within correctional facilities statewide for a number of years now. We have had upwards of 1,600 inmates during my tenure as sheriff. And as we sit here today, our inmate count, the daily count, is routinely now hovering right around or just under 1,000. So our as-built capacity down there is 1,240. So yeah, overcrowding is not an issue. We have been able to take some of the residential space that we've got down there, the unit space, and use that for intake when any new inmates are coming in, so that we can keep an eye on them, monitor their health before they're classified and placed in the population. Lawyers are still coming down to visit with their clients, but they're doing that in a non-contact basis. Again, coming back to the families, I know a lot of folks are very, very concerned about their loved ones who may be spending time with us down at the correctional facility. If there are questions, certainly people can call us, but we have made efforts, and with the assistance of our telephone service provider, we are providing increased phone service, and many phone calls are being given free of charge to our inmate population so that they can reach out and let their families know that they are okay. Vans and surfaces, everything's being sanitized. It's problematic from the sense that it's a lot of extra work, but I want to give a special shout out to our staff, our security staff, our medical staff, and the vital administrative staff who have been coming to work every day. We've limited everyone's contact, but everyone has really stepped up and done a fantastic job. So shout out to them. I'm very proud of the way they've handled this situation, and I'm hoping that this will continue. I also want to note that of the 14 counties in Massachusetts, all 14 have sheriffs. We have conference calls on a daily basis with all the sheriffs. We are keeping each other apprised of situations that are arising and how we're dealing with these things. We have had numerous conference calls, not only with the sheriffs, but with state officials and also with federal officials. So we're keeping right up on top of the latest, and everything I can report right now is as good as it could be. Thank you.
Thank you. That was Plymouth County Sheriff Joseph McDonald. Joe, if you can stay with us, we're going to be receiving questions today from PlymouthInfo@PACTV.org. Those are for your questions. And now we see on the screen the Plymouth County Register of Probate, Matthew McDonough. Matt, welcome.
Hi, Steve. How are you?
And Matt, I know in our world, I get quite a few of your orders that have somewhat changed and been modified from time to time. People want to know whether they can still get into court on emergency matters. Tell us a little bit about what's happening at the Plymouth Probate Family Court.
Sure, Steve. As the sheriff said, this is a constantly changing environment, and we're trying to adapt. Communication is key. We've had great communications from the administrative office of the trial courts. I'm in touch with my local registers and registers across the state, trying to put into place best practices for a really fast-changing environment. Our goal, though, as you said, is to keep emergencies flowing, to make sure that people in Plymouth County can reach the courthouse telephonically and be able to have their emergency restraining orders, do not resuscitate orders, temporary guardianships, healthcare proxies, and other emergencies matters handled telephonically as quickly as possible.
And certainly a lot of people aren't aware of the type of emergency business that you handle, but these are things that can't wait often, that they still have to go on.
That's true. Typically, people think of us as handling probate matters when somebody's passed away, what happens with their estate, or with divorces. But we do handle numerous other matters from guardianships, adoptions, change of names, equity cases, and as I already mentioned, the healthcare issues that come up. One of the concerns that we have about flattening the curve is to make sure that we don't overwhelm our hospitals, because we have so many people who need legal assistance to be able to determine what kind of care they will receive once they are in a hospital.
Sure. So Matt, if you can stay with us for the questions, and we'll come back to you. Thank you. And at this point, we're going to go to Amy Naples. She is the Executive Director of the Plymouth Area Chamber of Commerce. And we heard a little bit earlier about the restaurants. Amy, welcome.
Hi, Steve. Thank you for having me once again. First and foremost, I want to thank the community for supporting our local businesses. Our takeout has certainly been very busy at our local restaurants. So thank you to everybody that has taken action. We certainly encourage to continue that and purchase online wherever possible. I did want to share a few updates. I received an email from Melissa Riggy, our town manager, this morning, and we had shared that on our Facebook page. A great way to stay on top of all of our news is through the Chamber's Facebook page, Plymouth Area Chamber, as well as our Chamber website. We have a COVID-19 tab on our website with all updates and important links. In addition, the Department of Public Health announced in order to close hair, nail salons, barbershops, spas, body art, bodywork facilities, effective March 23rd. We want to communicate that out to our members in the business community. In addition to that, if anybody has any supplies that they can donate to our local hospital, such as gloves, face masks, please do so, because a lot of those industries do use those and will not be needing so for a couple of weeks. I want to mention we have launched a virtual cash mob, very similar to our typical cash mob where we surprise a business and purchase goods from them. So we are doing it virtually. You can buy online, order takeout, order flowers, support any small business, tag the PACC, and you'll be entered to win a gift card from a local business. So please do so, utilize your Facebook page, and you could win something special from the Chamber. As we all know, every industry is impacted right now, and certainly the event industry is. Our local florists are certainly struggling. Funerals are canceled, weddings have been canceled. So I want to encourage the public to send flowers to our loved ones. We're going to have birthdays, anniversaries, deaths happening during this time. And please reach out and think of your local florist during that time. In addition, our salons and retailers are struggling. The salon closures, it's going to be a tough one for all of us women, I think. We're going to know everybody's natural hair color in just a few weeks. So I think it's a good opportunity to you to buy gift cards, call the salon, email them, whatever it can be. Any sort of cash flow is going to be very helpful for them. In addition, the liquor stores, people certainly are visiting liquor stores. I want to remind you all to think small when you do so. They need our support, and the smaller ones certainly do. The auto industries are open, your local service stations, and I wanted to communicate that they are taking extra measures and precautions and sanitary procedures. So you are safe going to those. We are working with colleagues on various topics with the chambers in Massachusetts for collaboration and recovery efforts, as well as best practices and sharing ideas. And we've also our chamber has launched a survey to gain feedback from our members so that we can better advocate for them. So if you're a chamber member, certainly fill out that survey. It's going to be very important for us as we gather information, see how we can help assist. We also launched a Facebook support group. It's PACC, Small Businesses Coming Together. That's a place where people can really vent, share ideas, collaborate. There's good opportunity for collaboration, so we certainly encourage you to do so. So that is a private group for chamber members, so certainly anyone in the business community that wants to join, please, I encourage you to find that page. In addition, we are learning about live on-demand workouts from many of our members. We'll be sharing that as well on our Facebook page and website. It's a great stress reliever and something that I think we all could probably use nowadays. So certainly we will be sharing those opportunities for you. And as always, I encourage you to think local before any purchases.
Thanks. That was Amy Naples. She's the Executive Director for Plymouth Area Chamber of Commerce, and Amy will be staying with us to answer your questions that can come to us from PlymouthInfo@PACTV.org. Now, once again, last Saturday we had a 2-hour opening presentation, and our second hour was filled with very important information about public health in the town of Plymouth. At that time, we were joined by Karen Keene, who was with us yesterday, our Plymouth Director of Public Health, and the chairwoman of the Plymouth Board of Health, Brigitta Keene, who is with us once again today. Welcome, Brigitta. If you can unmute yourself, and we welcome you today to join us.
Good afternoon, everyone, and thank you, esteemed moderator Tripoletti, for inviting me today. As you know, I'm the chairwoman of the Board of Health, and today I want to talk to you seriously about your health, your family's health, your pet's health, and the town of Plymouth's health. As you know, we are now living in a time of pandemic disease, and the way we're going to come out of this on the other side to resume our lives is by coming together as a community of people who care about one another. Excuse me, somebody's trying to call in here. How do we care? By staying apart. Yes, it's a paradox. We're going to come together as a community to stay healthy by staying apart. It's now called social distancing, a phrase that is so new, but so important. You are being asked to make sacrifices. The Board of Health and all of the professionals in town know that and respect you for that. So here are some very important tips that could save a life in your community. Now, I wanted to show a short video today, but I can tell you that I'm not that good at Zoom, and you'll have to forgive me, I'll get better. I'm actually gonna try something with this video because it's all about surfaces. So see if you can see this. Can you read this?
Yes, we can see that.
So here it goes. All right, plastics, 72 hours. Stainless steel, 48 hours. Cardboard's important, 48 hours. That's why it's so important that if a person touches any surface where the virus is present and then touches their face, they're at risk. Avoid public spaces, wash your hands frequently, don't touch your face. This is important, let me get back to it, because that's how the disease spreads. Now, I want to give you a little bit more of an insight. The coronavirus itself multiplies in mucous membranes, and it's covered by a lipid membrane. Lipid is fat, grease. Just like you use detergent to break up grease in your sink, soap and water breaks up the greasy membrane around the virus, and it can't work. That's why soap and water is the best thing that you can use to break up this virus and make it not work. So wash your hands with soap and water and don't touch your face. I'm going to demonstrate. These are mucous membranes. Your nose, mucous membranes. Your mouth, a mucous membrane. This is how the disease gets into your body and goes to your lungs. This is a respiratory disease. That's why one of the symptoms is a bad cough. So I want to give you a little bit more advice. If you get flu-like symptoms, take your temperature, and it's now your thermometer. If you have a fever, it's your thermometer. Don't let anybody else use it. Stay by yourself in your home and treat your symptoms, fluids, fever reducers. Call your clinic or your doctor about a test, and you will get instructions. Don't go to any hospital or clinic unless you are instructed to do so. Remember, there are sick people in hospitals. You don't want to get exposed if you don't have the coronavirus. Wait for instructions. The purpose of a test is not to make you better, but to tell you that you must stay away from people. That's the purpose of the test. You already know how to do that. It can be miserable, but you will get better. A week or two seems to be the course of the sickness. Don't worry about your dog or cat. The last thing you want if you're not feeling well is for your little dog to be locked out of your room, and they'll be miserable and you'll be miserable. They won't get sick and they won't make you sick because you're already sick, but they won't make your family members sick. A good idea not to let them lick people's skin a lot because that's not quite been figured out. But the dog won't get sick from you if you're sick, and the dog won't make you sick. So lastly, I want to mention stress. I had a little graphic to show you about stress, but it's okay. I can't bring it through. The American College of Cardiology just put out a directive for those in cardiovascular care that said that people with heart disease, and particularly people who have had myocardial infarction in the past, are at higher risk for the stress that this coronavirus is putting on our community as a whole. So if you've had a heart attack or you have cardiovascular disease, I want you to be very careful to work with your friends and family to reduce your stress. Reduce your stress in the ways that make you happy. Talking on the phone, taking a long shower, reading a book, watching a movie at home. Anything that makes you happy will reduce your stress. So what I'd like to say just in wrap up, I actually have, and if moderator Triffoletti wants to give me about 3 more minutes at the end of the broadcast, I want to present to you some myth busters about COVID-19. There's a lot going on Dr. Google these days and on the internet that just isn't right and it's not accurate, and people may be taking advantage. And Facebook isn't any better, nor is Twitter. So I'd like to give you some myth busters from the World Health Organization. But right now, I want you to reduce your stress, social distance, wash your hands, don't touch your face. That's the way you get sick. If you're too close to people, that's the way they get sick or you get sick. And keep to yourself if you get flu-like symptoms. Remember, we're all in this together, apart. Thank you.
Thank you. That was Brigitta Keene. She is the chairwoman for the Plymouth Board of Health, and she brought up a very good point, which is one of the reasons why we are providing this daily program is we want you to receive verified information from trusted sources. And one of those trusted sources would be Representative Matthew Muratori, who joins us once again to give us the state perspective and how that relates to Plymouth. Welcome, Matt.
Thanks, Steve. Thanks, Steve, for doing this again. I do want to recommend to PACTV, when they put all of us up, Matt McDonough and I shouldn't be on top of one another. We should be separated. That could confuse people. So let's keep that in mind in the future. Just some updates from yesterday. As you know, we are, as legislators, on a daily conference call and are actually doing daily tweets from our leadership on what's going on and what's the latest. First of all, Department of Motor Vehicles, the Registry of Motor Vehicles, we're trying to get the word out to people to not to go there unless you really need to go. The governor, as of yesterday, has extended expiration dates on permits and all licenses, suspended road tests and knowledge tests, any certification of registration, number plates, titles, etc. Anything between March 1st and April 30th, that's all been suspended. So you don't have to rush to go get those done. In addition, the governor has announced a $200 million infusion into the Mass Health program as of yesterday, which will help the Mass Health providers to get payments and help the folks who are sick get well, and particularly those in nursing facilities as well. The idea is to keep people at home as much as possible, treat people at home through telehealth, as we talked about. So that $200 million in Mass Health will go a long way. In addition, the governor is going to be proposing again next week another $10 million in business recovery loans. As you know, this past week there was $10 million for small businesses for recovery, and there'll be another $10 million that's being proposed next week as well. So we need to stay tuned for that. In addition, waivers of late fees on taxes that were due for meals and room taxes is now in effect as of yesterday, March 20th, and that's through May 31st. So there will not be any late fees or penalties for anybody who hasn't paid their meals tax or room tax, and that will not be able to. You won't be assessed any fees or penalties on that. Also, I think Matt McDonough may know this as well, but for those that are doing real estate transactions, the smoke alarm inspection, that has been waived at this point, so as not to hold up any real estate transactions that were already in progress. But there is some language that talks about what the homeowner will need to do within 90 days of the recovery. So that's important information to get out. In addition, we talked yesterday about the elections. I am on the committee for municipalities, and we had a committee meeting via conference yesterday to go over the final bill that's being presented to the House and Senate on Monday. So we'll have more information on that probably by Tuesday, but it does look like the Senate election that we are having in our area on March 31st will be delayed. There will be some language in there with regard to town elections and the options that towns will have to delay if they choose to, depending on how long this goes, and other things with regards to municipal taxes, fees that are owed to communities, and what the delays on those will be. So more of that information will be coming out. The last bit of information that came out actually this morning had to do, and I think Julie or PACTV has the graphic on this, but it has to do with the unemployment. A lot of people are filing unemployment, thousands of people at the same time. And this is the site to actually go on, to actually find out all the questions you need. There are going to be a number of town hall type meetings that you can call into virtually during the week, starting tomorrow at 3:30, Monday at 9, Tuesday at 9 for Spanish Town Hall, Wednesday and Friday. We're encouraging people to go in. A lot of people have never gone on unemployment before. They're concerned if they're going to be able to get it. There's a lot of questions. This is going to be the best format for people to find out about unemployment, how it works. And if you haven't applied yet, I would recommend that you do apply now. If there is a delay or it's taking a while, we're asking people to try to do it later at night, go online later at night or early in the morning. Try not to do midday when it's really jammed up. But they are looking to do another call center as well to help the log jam. So that's what I have for an update for today, Steve.
Thank you. That was Representative Matthew Muratori, representative for the town of Plymouth. We've been getting a lot of questions this past week, and I have a number of the questions and the answers. But for those of you that have a question today, you can email us in the panel here at PlymouthInfo@PACTV.org. We're going to be going back to all of the people who are here today. I did want to mention a couple things. We've talked earlier in the week about the postponement of town meeting. One of the questions we received, if we do not hold town meeting until mid or late June, does that allow enough time before July 1 fiscal year commitments to pay our bills? And the response we received from the town, tax bills would still go out in a timely manner, providing that the town can input all the maps, the new lots, and deeds for July 1 bill due August 1st. The other thing that Matt mentioned with respect to the changes in the smoke detector law, we're getting a lot of questions about being able to still do filings. So one of the questions was, how do I get an occupancy permit? And currently in the town, they're working on a procedure to obtain an occupancy permit. In addition, there were questions about filings with Town Hall, with the Planning Board, and you can certainly contact the Planning Board by email, contact Lee Hartman. The question was, can we file a petition or application? The Planning Board, the Zoning Board of Appeals, the Historic District Commission, or Conservation Commission. And so at this time, the state has not suspended the municipality's statutory obligations for accepting new filings. But we're asking that if it is not urgent, that you delay the filings, and you can contact Lee Hartman, the Director of Planning and Development. He's at lhartman@townhall.plymouth.ma.us. At this time, we're going to go back to our panel for further comments now that you've heard everybody speak. And I see that Matt wants me to go back to him first. So we'll start back in the rotation. Representative Matt Muratori, one of the advantages to Zooming is they can, like in those presidential debates, they can raise their hand. Matt Muratori, go ahead.
I'm not being Bernie Sanders by waving my hand.
No.
Steve, I just wanted to follow up on that item on the budget that was asked. Part of that municipality bill that's going to the House and Senate that I just talked about will be allowing cities and towns that if we do go into July, the cities and towns will still have the capability to do a budget on a monthly basis. So it won't interrupt services going into the next fiscal year.
Thank you. So I'd like to go back to our newer panel guest, go back to Sheriff Joseph McDonald. Joe, before we came on camera, you were talking a little bit about what may be happening with masks being made available to you in your facility. I know Ken talked about the group that's going to make them, but what's happening with your group of 14 sheriffs?
Thank you for the question, Steve. One of the things that we discuss routinely amongst the sheriffs on our conference calls are the numbers of personal protective equipment that we've got on hand. Some of us have sufficient numbers. Most of us, unfortunately, do not have sufficient numbers. Thank goodness nothing's happening inside the correctional facilities as of yet, but we want to be ready. To that end, I found out yesterday that Hampden County Sheriff Nick Cochi, they have an inmate industry program out there. They've actually got their inmates working to produce those masks, and they're going to be getting those out to all the other sheriffs and actually probably some of the local medical facilities that need those as well. So that's good news that's coming out of our correctional facilities. We're all pulling together, and we're going to make sure that we've got sufficient resources, and when we have excess, we're going to make sure that we can share those with those who need them.
Good. And Joe, again, what about your current population? Is it up or down?
Once again, Steve, our populations have been decreasing for several years now, and it's not just us in Plymouth County, it is system-wide. All 14 county sheriffs have seen fairly substantial declines in populations. And a lot of this, people wonder, what is that attributable to? I like to think that a good part of that is decent rehabilitative programs that we have operating within our correctional facilities. But I also want to mention also the fact that we've got some active criminal justice reform measures that have passed of late, most of which are good, some of which I don't agree with. But the processes, also the specialty courts, so that you see a lot of people, what they're characterizing as low-level offenders. A lot of those folks that would in past years come to a correctional facility being able to be handled through a probation department situation, and they're actually not coming to jail. Bail reform has gone through, so it's much more difficult for individuals to find themselves held on bail. So those populations as a result have declined. Again, we've been as high as 1,650, 1,700 during the time that I've been sheriff. We are routinely now under 1,000. So our as-built capacity at the correctional facility is 1240 or 1250. So overcrowding is not an issue at really any of our correctional facilities. I do know there's some questions on both sides of the issue and maybe some apprehension out there about movements to release inmates based on this COVID-19 virus. We don't have any plans to do anything like that in the short run. There are a lot of problems that would be presented by that type of a situation, not the least of which, re-entry is the most important thing that our inmates are going to do when leaving the correctional facility. And our staff, our program staff, works very, very diligently and very hard to make sure that a lot of these inmates actually have a plan when they're leaving, which starts most importantly with a place to go and actually live. And not everybody has, unfortunately, a family that they can return to. So we have got to be prudent in how we make those decisions as to, what's going to happen when people are leaving the correctional facility. So just to allay people's fears, there are no plans and no requirements and no necessity for any wholesale release of inmates from the correctional facility. That is going to be, we'll reassess later on. I've worked very closely with DA Tim Cruz. We've talked about this. If there are instances where something may need to be done, we'll deal with those on a case basis. The other important thing I think that people need to understand, if you have a family member or a loved one that's staying with us, as I said, we do not have the presence of the virus within the correctional facility. Our job is to try and keep that out. And, like our folks in the nursing homes, these folks are going to have access to top-rate medical care, which we have. And I think, Harold had a story this morning talking about how many of our inmate population who would be vulnerable on the outside are actually going to be safer and more secure within the correctional facility. So our populations are down. We're able to exercise some of these measures like we're doing on the outside. And I think, knocking on wood again, that by the grace of God, the whole system is up, it's running, and everything is good with us.
Joe McDonald, one last question, Sheriff,
Sure.
and that would be, if people want to contact you or the facility with questions, what number do they call and how do they email?
Well, you can certainly email any of us. The main switchboard number at our communication center is 508-830-6200. And if there are specific questions that people have, we'll certainly try and direct them to the appropriate person to answer those questions. Sometimes that person is me, sometimes it is not. And I see that we have the website up there. We're going to be posting information for everybody on our website, www.pcsdma.org. So, certainly please call with questions. The sheriff's office is standing by. I know that, things are going well for us, and I'm happy about that. We want to make sure it stays that way. We're going to work closely with our local law enforcement and public safety and make sure that all of the sheriffs statewide have what they need. So call with questions, check the website. Hopefully we'll get you answers as soon as we can.
Thank you, Joseph McDonald. He is the Plymouth County Sheriff. Your questions can come to PlymouthInfo@PACTV.org. And at this time, we're going to go back to our other Plymouth County official, and that is Matthew McDonough. He is the Register of Probate. Matt, welcome back. So Matt, we heard earlier about the fact that we can still have some hearings at probate court. The building is open. We really don't want people to go into the building. So how do people contact the Plymouth Probate Court if they're not going to come into the building? Do they call?
Great question.
Go ahead.
Great question, Steve. So as you know, our Plymouth Trial Court building is located at 52 Oberry Street, and we have several different divisions of the trial court in the building. So I don't want to speak as to what every different division is using for a protocol, but within the probate and family court, if you come to the courthouse, you'll be greeted by court security officers right at the front door, and their job is to help triage why you're in the building and make sure you get directed appropriately. If you're looking to come to probate and family, they will give you a phone number to call. If it is an emergency, you could call us from just outside of the building or go back to your car. As of right now, however, we're not taking any visitors at the counter. And that's for the exact same reasons that we saw in the video earlier about how our understanding of the virus is that it could live for a long period of time on hard surfaces, door handles, pens, and pieces of paper within the building. So if you do need us, you call us. Our phone numbers at the Plymouth office are 508-747-6204. And our Brockton office is 508-897-5440. And we also put up regular updates on a website that I developed called PlymouthCountyProbate.com. If you need an emergency situation, we will triage it and get it handled as quickly as possible. We've had several different ways. We're trying to think outside the box, whether we scan and email you a blank form, have you scan and email it back to us. For folks, especially the elderly who may not have access to technology like that, we will help to transcribe information as quick as possible so that we can get it up to our assistant judicial case managers and have the judges look and evaluate as to whether or not it is an actual emergency that needs to be handled that day. If it's an emergency that needs to be handled that day, they can handle it telephonically, or if it's a more adversarial situation that requires an in-person hearing, we do have video conferencing capabilities. Oh, and there's Matt Muratori again on my screen. They do confuse us quite quickly, but I think that's probably my hint. They want to go back to you. But I just want to emphasize, folks, that we're here to help you with emergencies. We will do the very best we can. It is a new way of operating the courts, and we're taking every challenge in stride. And I also want to say to my staff in the Plymouth and Brockton offices, excellent job over the last 2 weeks. We're on a skeletal crew so that we can keep our numbers under 10, which is according to the federal guidelines to limit the spread of this virus. That does present natural limitations to processing cases and working the phones, but my staff has done an excellent job. So I hope everybody is staying safe, and anything I can do to answer questions in this meeting, I'm happy to do.
Thank you, Matt. And I can say from personal experience, we have had emails coming in from your office, from your staff. They've been great about keeping us updated so we can keep clients updated in the community. It's all very helpful. Thank you. And at this time, we've got a couple of questions. So I think maybe Matt Muratori, since you were maybe signaling Matt McDonough, maybe this question goes to you, if not to Amy. And the question is, I work for a private residential school. They don't pay into unemployment. Is there anything I can do for compensation? And if you don't know the answer, where can we refer them? Matt Muratori, you got
Oh boy,
a thought?
that's a good question, Steve. I'm gonna write that down. I'll see if I can find out the information. I'll check with, a shout out to Betty DeBenedictis, my chief of staff. She's doing a fantastic job in finding out all this information. So I'll reach out to her and see if I can get that answer tomorrow.
All right, and again,
Unless Amy knows.
I don't know. I
No.
was just going to say, I'd probably be reaching out to Matt for assistance, so.
yeah, so for those of you asking a question that we can't answer, we will answer it in an upcoming presentation. Matt, maybe also back to you. I know that a lot of things are being extended. One of the questions came in, is the auto inspection deadline being extended?
Haven't heard that one yet. I don't think, but I'll find that one out as well. I know there's some discussion about that. I'm just not quite sure if that happened yet, but I'll double check that.
Okay, thank you. And now as we circle back to the people, Amy, anything else that you want to add with respect to the business community?
Certainly. So if there is any business in need of assistance, please don't hesitate to reach out to the chamber offices at 508-830-1620, or certainly to me directly at amy@plymouthchamber.com. If I don't know the answer, I will rely on the great community leaders we have to support me in providing those answers for you. As always, I encourage you to support local business before purchasing anything. And in addition, I want to give a big shout out and thank you to Julie Thompson, the executive director of PACTV, and her staff for providing the around-the-clock coverage and important resources to our community. And Steve, for your leadership and commitment to the community as well, and providing this very important platform for all of us.
Thank you, Amy. And Amy, we don't have to be a chamber member to access the chamber website. Is that correct? And how do people get that?
Yep, PlymouthChamber.com. You can access the website. We have a membership database there, which features all of our members. Certainly, you don't have to be a member to reach out to me either. Certainly, I just want to be able to be there to assist our business community any possible way. So if you are a member or not, please reach out.
Thank you, Amy Naples. She's the Executive Director for the Plymouth Area Chamber of Commerce. We're now going to go to Brigitta Keene. She, once again, is the chairwoman of the Plymouth Board of Health. And Brigitta, before we go to your comments that you wanted to make earlier, tell us about 211. What is that? What was mentioned yesterday?
Oh, yeah. We talked a little bit, actually a lot last week, because for 1 week now, there's a Massachusetts hotline. It's 211. And in multiple different languages, 25 different languages, you can speak to someone live about your concerns about the coronavirus or COVID-19, which is the disease that the virus causes. It's up, it's active. You might have to be put on hold for a while or they'll call you back, but it's been very successful. A lot of people have been very happy with it. You can also go to the town website, and when you put in the town website, you'll see a red banner, and that banner says click here. It'll take you to the Department of Public Health and all of the updates that we have that are the Massachusetts Department of Public Health and the CDC are on those. You can call Town Hall And you can just press the button when it says, if you need to know more about coronavirus, you'll be connected to a audio about coronavirus. So there's lots of different ways that you can stay in touch with the real facts. And I also want to emphasize that the Board of Health, all of the 5 members, and the Department of Public Health is working within the public health community on almost an hourly basis to put those things into the town of Plymouth that Plymouth needs when we need them. I think it's important to know that we are implementing what the town needs when the town needs it. So every town is in Massachusetts has different needs from the public health department at different times, but we are really working very closely together to meet those needs. Can I put my Mythbusters in now?
Please do right now and give us your contact information.
Oh, sure. So what I'd like you to contact me at my email, that is BOH, that's for Board of Health, BOH.chairtalk@gmail.com. Send me an email. I'll get back to you as quickly as possible. And I would appreciate any questions that you have. So here are a series of Mythbusters. These are from the World Health Organization. So there's a fact. The new coronavirus can be transmitted in areas with hot and humid climates. Fact. Cold weather and snow cannot kill the new coronavirus. Fact. Taking a hot bath does not prevent the new coronavirus disease. Fact. The new coronavirus cannot be transmitted through mosquito bites. That's a good thing. It's mucous membranes. Here's a question. Are hand dryers effective in killing the new coronavirus? No, hand dryers are not effective in killing the virus. Can an ultraviolet disinfection lamp kill the new coronavirus? The World Health Organization asks you to please stay away from UV lamps, and they should not be used to sterilize hands or areas of skin. How effective are thermal scanners in detecting people with the new coronavirus? Those are those little guns they point at your forehead and give you a temperature. It says the thermal scanners are effective in detecting people who have developed a fever. But because they have a higher than normal body temperature. However, they cannot detect people who are infected but are not yet sick with fever. That's the reason we social distance, because some people who are sick with the virus do not show symptoms. Can spraying alcohol or chlorine all over your body kill the new coronavirus? No. Spraying alcohol or chlorine all over your body will not kill the virus. It's important to know that once the virus is in you, spraying on the surface of you will not kill the virus. Do vaccines against pneumonia protect you against the new coronavirus? No. Vaccines against pneumonia, such as pneumococcal vaccine, does not protect you against this new virus. Currently, we have no vaccines against this virus. Can regularly rinsing your nose with saline help prevent infection with the new coronavirus? No. There is no evidence that regularly rinsing the nose with saline has protected people from infection. Can eating garlic, we won't even go into that. Garlic's good for you, but it doesn't protect you against the virus. It just might make people stay away from you. Does the new coronavirus affect older people or younger people? People of all ages can be infected with the new coronavirus. Please keep that in mind. There are just some that are more vulnerable to getting sicker, and those are older people. Are antibiotics effective in preventing? No, antibiotics do not work against viruses, only bacteria. And are there any specific medicines to prevent or treat the virus? To date, there are no medicines to protect against or to treat the virus. Thank you for listening to all my Mythbusters. If you have any questions about them, please email me and I'll give you more information. Thank you.
Thank you. That was Brigitte Keene, and she is the chairwoman of the Plymouth Board of Health. And as we circle back on our panel, one more time, Representative Matt Muratori, how do people contact you if they have questions?
They could just email me at Matthew, M-A-T-H-E-W, 1T in Matthew, .Muratori @mahouse.gov. Or they can call me on my cell at 508-930-2979.
And Matt will be back with us every day, as will Selectman Chair Ken Tavares or the town manager. Ken, what are your final thoughts today?
Steve, they really center around the appreciation that the Board of Selectmen has for so many people in this community performing good deeds. It's more than I can even name, and if I did, I would miss some people. This community is coming together as it probably never has in our lifetime. And we are appreciative of our town workers, our hospital, PACTV, the schools, everyone that is doing something to help. Again, I want to emphasize, as others have in the panel today, that it is so important to keep the social distance. It's actually easy to do. We've had people come to our home today to drop off supplies to do this mask project. And the conversations take place ahead of time. The door opens. There's a good 6 feet separating us from the people coming here, and it works. And this is something that we need to do. We cannot emphasize this enough, how important it is. But also, I think through all of this, what I'm learning as an elected official is that there's hope. And there are many things that we can be thankful for, even though the news is not good most of the time. This we will pass through. And I want to leave our community with a writing that I was able to have sent to me this past week from the internet. And I think it sums up, where we are and where we will be. And with your permission, I'm going to read this. And the people stayed home and read books and listened and rested and exercised and made art and played games and learned new ways of being and were still and listened more deeply. Some meditated, some prayed, some danced, some met their shadows, and the people began to think differently. And the people healed. And in the absence of people living in ignorant, dangerous, mindless, and heartless ways, the earth began to heal. And when the danger passed and the people joined together again, they grieved their losses and made new choices and dreamed new images and created new ways to live and heal the earth fully as they had been healed. That was written by Kitty O'Mara, and I think it's good words for all of us to reflect on. Thank you, and we'll see you tomorrow.
Thanks. That is Kenneth Tavares. He is chair of the Plymouth Board of Selectmen. Again, thank you to everyone who participated today. Representative Matthew Muratori, who'll be back with us again tomorrow. Also to Brigitte Keene, the chairwoman for the Plymouth Board of Health. We thank once again Amy Naples, the executive director for the Plymouth Area Chamber of Commerce. Matt McDonough, who is the register of the Plymouth County Probate Court. Joseph McDonald, who is the Plymouth County Sheriff. And coming to you tomorrow, we'll be joined by Stephen Cole. He is Director of Economic Development in the town of Plymouth. Also, Reverend William McCoy, who will talk about ways to virtually worship on a Sunday or a Saturday, as your faith may determine. And also, he will be talking about his work working with victims of abuse. And at these times, he'll be providing some information and resources. Monday, we have Plymouth Police Chief Michael Botieri joining us, along with Plymouth County Register of Deeds, John Buckley. And on Tuesday, we expect to have Edward Bradley, who is the Plymouth Fire Chief. So a lot of good information coming to you with these daily presentations. They're coming to you live from PACTV offices here at Fort Collins Ave. This is a presentation. We thank everybody who's participating. We thank you for joining with us. I am Steve Trifletti. I'm Plymouth Town Moderator. Good day.